If during a microscopic study of your semen, the specialist finds more than 1 million leukocytes, white blood cells, per milliliter of sample, it may be an indication that there is an infection present, in which case the sperm sample will be cultured under laboratory conditions. This is basically a way of growing the bacteria that is present in the sperm sample so we can identify any bacteria there and if there are any infections. If any infections are present, these can be then treated to help aid the fertility in the future. A semen culture also may be ordered if the man has noted any pain, any swelling, any discoloration or an unusual smell to their semen. These can all indicate there may be an infection present, and so your specialist will order a semen culture.